Is it possible, since we are talking about CPF Life, we are talking about insurance, is it possible for coverage to be extended to men? How much of that coverage do you believe could be extended to mental health coverage? I mean, I'm not sure whether there's that conversation going on.
Definitely the conversation is going on. Definitely mental health coverage is now included in Medishield, and in Medishield Life, definitely. Even in the use of Medisave for mental health related problems, it's available. So it's not as if we're making that move. For a long time, we did not have that. When it comes to direct support, I mean, you're talking about very tangible stuff.
Yeah.
We do have support for patients and caregivers to a degree. And I think perhaps sometimes it's that communication, allowing people to know that this is available and making it a proactive step rather than, okay, if you come and look for it, writing many letters. I think it's a lot better if we are, we are proactive and we actually, so that's part of, I think, a system where it's both ways. If you go to the hospital and you see that the doctor doesn't wash their hands and they're coming in to treat you, isn't it good for you to tell the doctor, hey, wash your hands now, you just saw another patient? That's the conversation that we should be having. Get people a little involved in this whole process. Sometimes we forget.
Well, that's why we're having this conversation, so that we're listening to each other, But I think the point about, unfortunately, I mean, whichever way we see it, the onus is very much on the government to use this mechanism to communicate, if these things are available, to communicate. Because when a person is going through all the stresses, it is going to be difficult to expect that the person who is affected to go and look for avenues.
Absolutely.
So I think we need to call a spade and say, in this case, the primary responsibility has to be with the agencies, with the government, to actually communicate that such services are available.